So I'm Eric Massey. I'm a regional director for Intellis. I currently oversee our West Field Service Division across the Western U.S. and the state of Florida. I've been in this industry now for 25 years. I started out as a biomed technician, and I've worked my way up to a director's level. Started managing small community hospitals, eventually large health systems across the U.S., and then today into my current role managing our field service division. I recently just got certified as a high performance coach, and I started a business on the side called the Massey method, which is to develop future HTM leaders and other leaders outside of our industry. And I'm also a member of the Colorado Biomed Association board. So, what you're going to hear today is a presentation, on some of my experiences and failures as a director, things that I've learned, and my passion for coaching other people in this industry right now. So let's dive in. So this is our number one problem I feel that we have in our industry is firefighting mode or reactive mode. This is HTM. We constantly have systems down, so you're constantly in a reactive state of mode. And firefighting mode is waking up out of your bed, constantly answering emails, text messages, phone calls, your calendar's just filled meeting after meeting after meeting, and you're doing a lot of work, moving around throughout your 8 hours of work, but are you really actually accomplishing anything? How many of you in here, agree with what I'm talking about in this industry, that this is a very reactive industry? So hopefully today when we walk through this, you get some things on, how to work more in leader mode rather than reactive mode. So I always worked in reactive mode through most of my career. Every phone call that came in, I answered it. Every text message came in, I answered it. There was a system down. I was going to where that system was down. And, I bounced around from place to place, and I was working really hard. People in the industry, said, hey, Eric, you're on top of your game, you're on everything. But realistically, I was burning myself out inside trying to be everywhere, answer everyone's phone call, and text messages. And it wore on me. It affected my health. I was always athletic most of my life. I played sports, football, baseball, box. I was in great shape. And then I ended up putting on a lot of weight, and I got up to 275 pounds at one point because I wasn't taking care of myself. I was just working all the time, not working out. It started affecting my relationships at home. I wasn't available to my friends, to my family, and it broke me down. And then one day, I was in Orlando, Florida. At that time I was managing a health system in South Carolina, and then one in Florida. I think it was a total of 28 hospitals at that time that I was going back and forth managing. I wasn't sleeping, wasn't eating, and I woke up one day at the Embassy Suites in Orlando, and I had severe chest pains. I felt dizzy, like I was going to pass out, and I thought I was having a heart attack. So I ended up going to the hospital after my business analyst talked me into it over the phone. So I went to the hospital. They immediately checked me in, and they were running my vital signs, my blood work, and they put me into one of the ER bays. And when they did that, I took my laptop out, hooked it up to the monitor in there, so I had my double screens going, and I was working on my finance report. And the doctor came in and he looked at me and he's like, this is what's wrong with you. And I'm like, what? And he's like, this. He goes, we ran all your blood work, all your vital signs, everything checked out. You're not having a heart attack, but you're killing yourself with work. He goes, you're in here, you think you're dying of a heart attack and you're still working. And I'm like, well, just because I'm dying doesn't mean the finance report doesn't have to get done. So I did it. And I got a call from the president of our company that day too. And it was funny when he called me, he's like, where are you? I'm like, in the ER doing my finance report. And I said, Orlando Health. He's like, that's not one of our accounts. And I'm like, I know, I'm a patient. And he's like, what? But yeah, and that's how, stuck in reactive mode I was. But that was my wake up call. And I was like, I don't want to die young. I need to make changes. And, I talked to my boss at the time, who's Lisa Fry, one of our vice presidents. And, I was lucky to have a really, really good boss. And she ended up hooking me up with a coach through Compass Group. They offered this Better Up program. And I started getting coaching where they're teaching me how to manage my time, manage myself a lot better. And, that's where I started developing the passion to teach others in our industry about this because I was like, man, I wish I had this 20 years ago when I started getting into leadership. You know, I was just a technician coming in here. You know, I knew the equipment very well. I knew the policies and procedures, but I didn't know how to manage myself or manage others. And, you know, that's what I got from that coaching. And then once that expired, I ended up hiring my own coach, which I still have today. And after I'm done this, I have to go upstairs because she's going to coach me for an hour today on how to better myself. So I keep up on this stuff. And this is where, you know, that passion came from. And that's the leadership gap that, you know, we see in HTM. And this statistic I got out of a magazine, it's not just for HTM, it's for leaders in general. 70% of them, first-time leaders, fail. And it's because they don't get the appropriate training. They're very good at their craft. They're very good at managing their book of business, but they have no idea how to manage themselves or to manage other people. And, you know, we have plenty of technical trainings in our industry. You know, we have leadership trainings where they teach you about the policies, procedures, you know, joint commission, but we don't really have any training in our industry on people how to work for themselves. You know, I'm lucky I work for a Compass Group, a large business that, you know, has these things to offer to us, but a lot of people don't have this out in the field. And what's the cost of working in reactivity mode? It's overtime spikes. You know, if you're reactive throughout the day, you're constantly answering emails, text messages, you're in meetings, and you're an hourly paid director, you're going to be working and doing those needle moving things at night because they still have to get done, but you're not getting them done during business hours. And if you work for a hospital, you're driving up their costs. If you work for a third-party vendor like us, you're driving up our costs. It causes overtime. And the same with technicians. If you're not, you know, developing your technicians and teaching them how to manage their time, you're going to have overtime spikes because they're doing their work after hours too, because they're not focusing on the things that matter during the day. Also vendor dependency. If your technicians aren't managing their time, you're having to call in vendors to pick up this work. That's more cost for your company, more cost for the hospital. Then it leads to burnout like I had, where I had to go into the hospital, and turnover. You know, if people don't have the proper work-life balance, then they're not going to stay with you. They're not going to continue to work with you. They're going to want to go somewhere else where there's more balance. And then lost trust with clinicians and your customers. They're going to see this in you too, because if you're in reactive mode, you're going to be all hyper. Trust me, I was like this. Ryan, you've worked with me. You see me all crazy running around. You know, people read that on you too, and you know, they're not going to trust you. They're not going to listen to you. So there's a lot of costs when you work in reactive mode. You know, from firefighting to frameworks here. So you need to learn to master yourself first before you master your systems. You need to understand yourself. You also need to, you know, you manage your energy, your time. And once you take care of all that, then you're ready to go manage your systems and the things that you need to do your job. So the first thing I'm going to talk about here is the 60-40 rule. So I got certified just last week as a coach from Brendan Bouchard. And this is something that he teaches through his program is the 60-40 rule. And what the 60-40 rule is, you spend 60% of your time focusing on the high impact work, the things that are going to move the needle forward. You know, your service delivery plans, checking your finances, vendor support, training plans, customer relationships. And then also part of this, which you'll see in the next slide, is also relaxation and managing yourself too. And then you still have to do everything else. You still got to answer the emails. You still got to answer the phone calls, deal with the craziness. But 40% of your time should be spent on that. So this is a quick look at, you know, a typical work schedule. This is similar to what I do, but I start my day at 4 o'clock in the morning, not 7:30. I do a morning routine and then I get into this, but you know, Randy, who works with me here, he can speak to this, and that I preach this all the time to my directors. And this is absolutely mandatory for my directors. They're not allowed to check their emails, text messages, or phone calls for the first 3 hours of the morning. They need to be working on needle moving activities. I have them put the focus on their iPhones so that no one can get a hold of them. And you know, when I first heard about these deep work blocks in my coaching, you know, both coaches said this. So the Better Up coach said, you shouldn't check your email, phone calls, or text messages until 1 o'clock in the afternoon. I was like, dude, you know what industry I work in? That's not happening. And then when I went to Brendan's team, he said the same exact thing. You're not supposed to check your text messages, emails, phone calls until 1 o'clock. And I was like, I can't do that. So this is my own little thing I took from them, and I feel fits our industry, where blocking the first 3 hours. And what I explained to my directors and my customers, because I also let them know that we do this, so they understand that they're not going to get a hold of us during this period. But you know, what I tell them is that when you're in a quarterly business review, or you're presenting like I am right now, you know, are you on your phone? Are you texting people? No, you need to be present. You need to be there working on what you're doing in that quarterly business review. This is no different. This is your job. You have to work on service delivery plans, finance reports, all those things. So don't let distractions happen during this time. You still got to have a communication window to answer those emails. So right after that first block, that's when you block time in your calendar to answer emails, text messages, and phone calls. And you know, when you get phone calls and you're not blocking the time for it, and you're letting it go to, you know, just answering it right away, you're not prepared to answer that phone call. When you let it go to voicemail and you check it during your block, you actually listen to what they're looking for. You're able to get the answer, be more prepared, and then give it to them, whether it's through a phone call, text messaging, and you're wasting less time going back and forth trying to find that answer. And then I leave open in my calendar, you know, time for meetings. I mean, sorry about the time there. I should say 11 to 12 on that first block for meetings. And then I allow meetings from 1 to 2:30. So everything else, the communication window, the deep work blocks, they're all blocked in my calendar, so nobody can put meetings in during that time. So I can stay focused on these things. And another important thing is to recharge during the day. You can't just sit at your computer all day long. You need to have some sort of recharge. And when I'm at home, I go for a walk on the lake. I leave my phone inside the house. I go for a walk, no noise, no music. And then that resets my mind, you know, so I'm stronger for the rest of the day through those meetings. And I set a final work block here for an hour. So that can be used either to finish up what you were working on in the morning, or maybe something came out of your emails or your meetings that you have to do a follow-up on, and then that's blocked in your calendar for that time to go in there. And then the final thing, you know, one thing I get when I say don't check emails, phone calls, and text messages all day is, you know, if someone forgets to answer someone, well, you told me not to do it. No, the last block here is your final communication. I never finish a day without answering every email, phone call, and text message that I got. So this ensures that everyone's been responded to. If anything comes up, you can schedule it later in your week. But it also gives you a peace of mind for the next day that, you know, during your deep work block, that everything's been answered and there's nothing lingering into the next day. All right, operational excellence. So now we're gonna start looking at service delivery plans. You need to have a plan for every single asset that you manage. So I'm gonna take a look at a sample one here. So this is a sample service delivery plan. This is an imaging one. I keep imaging and biomed separate because imaging is more specialized, and you need to build your service delivery plan by device type rather than facilities, because you can't just have an imaging service manager, service technician on site that can work on everything. It's too specialized. So, you know, I break this down to CT techs, MRI techs, cath lab techs, you know, what they're specialized on. And I do this also for the high-end biomed, your anesthesia, sterilizers, ventilators, you know, things that people are specialized on. And on the biomed side, the low-end biomed, you know, it's mostly broken out by departments. This person's in charge of cardiology, this person's in charge of the OR. But the thing is here, you need a plan for every asset. I don't know, you know, you guys all have different databases, but you can build this directly in your database too. I know ours has this built in, but you need to have a primary tech, a secondary tech at the minimum. You know, ours, we actually have a tertiary tech, so we have 3 options for every single asset. You know, is there any national support throughout your industry or your hospital system, anyone that's specialized on this that can give those technicians additional support, have them on that? Who's the vendor? If all your people can't fix this device, who's the vendor you're going to for support? Who's the vendor you're going to for parts? Is this under contract? If you can't get all this stuff in your database, you should have an Excel sheet like this and put it on a team site, SharePoint. So whenever a system goes down, you can filter to the asset and see the exact plan on how you're gonna fix this device. You know, when we go into like new accounts, I see how people manage their work order process, and I've seen some with just like cell phones where the work order comes in and it's like, hey, this is broken. Who's got this? Who's got this? And it says there's no plan. And then what vendor do we call? Who do we use for parts? If you're a good director and a good manager, those questions should never come up, ever. You should have a full cut plan built out either in Excel or into your database. So this gets built into our database, so the work order comes in electronically and automatically goes to the primary tech. And if they're not available, they check they're out, they're doing PMs or something, they'll check that they're out, then it'll go to the secondary tech. So it's all automated. You as a director don't have to sit there and even think, I need this person to go here, I got to call this vendor in. It's already built for you. So, you know, this is extremely important. And, you know, Randy and I just saw Tony walk in too. They hear me preach this all the time. Every single week, you need to be looking at this, making sure every single asset has the appropriate people assigned to it, and we have a plan for everything, right? All right. Now I'm going to turn it over to Randy. Randy's one of my regional managers, and he's going to speak to our PM process, because this is extremely important, making sure that every device gets PM'd and we're touching every asset.
Morning. My background, I've been with Crothall Healthcare, now in Talos, for many years. I started as an acute care manager. From that, I had the privilege of becoming an anesthesia specialist for the next 10 years. And I had to live by my calendar. I had to be very intentional. There's only so much time in a day. When you add travel arrangements, when we start adding OR schedules, I had to have a plan. And so we developed that for our technicians as well. We require a lot of them. We require that they do their preventative maintenance, that they do their corrective maintenance, and we require that they communicate with the client all the way through. Maybe I'm a little too close to that speaker. Is this better? All right. We require that they communicate, that they schedule before they go. We require that they communicate if there's any unable to locate equipment, and then we require that they follow up when they leave, so that way they've updated the department heads. They know what to expect. That's a lot to do. A technician always feels like they don't have enough time in a day. So we came up with a process that gives them some of that time back. We require that they schedule, they use their Outlook calendar. But they don't just schedule using a scheduled maintenance list of open work orders. They use the device list for that department or that clinic or that practice. And what that allows us to do is tell and communicate with the client what it is that we're coming out to check. And they have an opportunity to then look and see, is it still here? Have we gotten rid of this equipment? They have a chance to look for it. They don't always take that opportunity, but we've communicated what we're coming to do and what our intention is. And then we have extra columns on that. We have pass, fail, unable to locate. And we have a notes section. So we actually do our preventative maintenance on that Excel spreadsheet. Now we're using the laptop. We're not printing this out. We're actually carrying our laptops. You can do it for a mobile application as well. That way, when you're done, you can show and walk around with the clinic what was unable to locate. You can show them what PMs failed. And you can even email it back to them or put it back on the same calendar invite before you've even left the clinic. So that provides that communication and that feedback that the clients do like. It's really turned around our communication, because not only do they partner with us, they start seeing the value that clinical engineering is bringing, that biomed is bringing. And then when we've left, then we can take that Excel spreadsheet and copy and paste and complete our work orders. We're not in the patient workflow. We're no longer taking up their time, and the communication has definitely improved. It also helps transition, as Eric has been talking about. We have to be intentional. We have to have a plan. So as we're transitioning our technicians into that mindset, we're also turning their mindset away from a work order response mindset to a device management works mindset. So that helps prepare them for future leadership. Thank you.
Thank you, Randy. All right, the next shift here I talk about is financial and strategic leadership. You know, service delivery plans, as I mentioned, it's one of the most important things you have. But looking at your demand spend, you know, that's the second most important thing I preach to all our directors, is to manage that and reduce our overall vendor spend to vendors. And if you build the appropriate, this is a sample demand spend report that I have here, that I have my directors look at, you know, on a weekly basis, that they're digging into this. So when you're looking at your service delivery plan, you're looking at gaps, you know, that primary technician, are they trained on this device? How are we going to service this device? Do we reach out to a vendor on this device? So, you know, look at these, and this is where you build your training plans off, where you find your gaps. Wherever you're spending money on a vendor, you want to bring that in-house, because every time you cut a PO to a vendor for service, that's driving up your costs for your hospital, that's driving up your costs if you're a third-party company like us. So you look for training opportunities, and not, training's not offered for all these. I know AGFA is one that, we struggle with to get training. They do provide it to some in-house programs, but third-party people don't get training from AGFA. So then you got to look at, all right, what's my demand spend? What's my part spend look like on this? And what's the contract cost? Is it cheaper to contract this out and have a set price that I can easily budget for? Or does our current service delivery plan work, where we're able to do the PMs and, do most general repairs, but then have to escalate to the OEM to come in with the service key for certain calibrations? So you constantly need to be analyzing this to ensure that you have an extremely efficient program, because if you have trained staff on site, you're going to get that equipment up quicker, and you're also going to be reducing your vendor spend. So you're lowering the cost for the hospital, and you're getting the equipment up, which is also lowering the cost for the hospital, because every time that equipment's down, they're losing money. So it's extremely important to go through these demand spends. The other thing that you control is overtime. We mentioned before, overtime with the director, if you're reactive all day, you're having to do your work at night. By, building those blocks in, you're focusing on the needle moving things, so there's less overtime for you if you're an hourly employee as a director. But you also need to train your technicians too, how to manage their time. So one thing that we do in our area is, we require our technicians, just like the directors, it's not a 3-hour block, but we require them to block 1 hour in the morning to do all their paperwork. They have to do their PMs from the day before. They have to update their work orders, update their work order notes. So this way, it's taken care of in the morning. That's the most important thing, because the customer needs to see the data. They need to see the work's being completed. So that ensures that it's getting done, making that mandatory. Because what you see a lot of the time is they're constantly doing work, running from place to place. They're doing the paperwork at night, and that's getting overtime costs, driving up your costs. And sometimes it doesn't get done when they put it at the end of the day. It'll just go to the next day, keep snowballing, and then at the end of the month, you get them sitting there for a day trying to close out work orders. So we make it mandatory. So that gets 5 hours a week for documentation, 20 hours a month to ensure that's getting done. And you also got to coach your staff too. When they're doing PMs and a work order call comes in, use the secondary, tertiary vendors to handle that call. You shouldn't be doing PMs, breaking off, doing that work order, coming back. You're just wasting time. You had that time blocked to do PMs, do the PMs. You have other people that can help. So you need to work with your staff and build those things, because this is one thing that you can control as a director to drive down costs for your facility. Strategic parts and capital planning. So you need to understand parts and how they fail. I'm going to give a cath lab tube as an example. So an FD20 cath lab tube, brand new, estimated price probably about $110,000. You buy a used tube, say 2017, 2018, you probably get that for about $60,000 roughly. But if you go and use, and some people, they're just like, oh, this is cheaper, I'm going to go and replace this. But you need to think long term. You need to understand that that FD20 cath lab tube lasts 8 to 10 years if you buy it brand new. So if you buy that used tube, it's probably going to fail within the first 2 years. So you spend 60 grand there, spend another 60 grand in 2 years. 2 years later, spend another 60 grand. And then look over the course of the 8 to 10 years, you spend what, $180,000, $220,000 on tubes, where if you just spent $110K, you would have saved all that money for the hospital. And if you have 10 cath labs, add all that up. And that's a lot of money that you just wasted for your parts decision on that, not understanding how that part works. And buying the cheapest part is not always the best solution. Quality means a lot. So you need to understand your vendors, how they manage their parts. I've been to plenty of their facilities and toured their facilities because you want high quality parts, because if you're constantly buying cheap parts and replacing these things, you're just driving up costs for your facility and your company. So you need a good understanding of that. Using spend data to forecast and justify capital replacements. A lot of these hospitals have end-of-life equipment. They're constantly breaking, you're constantly replacing parts. So you need to look at what's the replacement cost of that device compared to the spend I have. If you're an in-house program, you need to sit there and talk with them, with the radiology director. I'm just giving examples to that. You know, we're spending X amount of dollars a year on repairs and parts. You know, if we just replace this now, I'm going to cut out this spend, and it's going to reduce our overall cost over 10 years. And, you know, you also, if you're a third party company, you got to build this into your contracts too, so they don't take advantage of you on that. And they're constantly, you know, there's like, oh, you got it covered with the service contract. But if your service costs are more than what the value of the equipment is, you need some protection in there where they need to go and replace this. So you need to constantly look at this stuff to make sure you're getting the best deal for your facility or your company. So proactive planning reduces downtime, costs, and surprises. Executive influence. This is how you talk to the C-suite. So, you know, the C-suite, they don't understand, you know, all the technical language that we speak. So you have to talk in their language. And the language that they speak is patient safety, financial outcomes, and strategy. You know, you have to lead through clarity, consistency, and relationships. So patient safety, you know, why it matters. You know, you gotta show them the repairs, you know, and what it's doing and how it's minimizing downtime, keeping this equipment up, keeping the patient safe. So you need to talk in the patient safety mindset. Financial outcomes. This should be number one to the hospitals. You know, they want to see how your decisions are saving them money, how you're reducing that vendor spend. You know, also reducing that vendor spend. You know, you have someone trained on site for immediate response. That's also patient safety. You know, we're keeping this equipment up longer because we have someone trained on site that can immediately respond. And then strategic alignment. You know, how does this support the hospital's mission? So you need to understand what their mission statement is. And when you speak to them, you know, tie these events into their mission statement. So I have an EOC report that I give all our customers where I break out their mission statement on the left, and then the numbers that I'm reporting out, how that ties into patient safety with the PM completions, work order completions. And then I have the finances in there, what their billables look like, their contract values. So that ties in the financial outcomes here. So I build that right into my EOC report. So when they look at the numbers, they see how it ties into their vision. So the future of HTM, it's changing, and AI is big. We really got to start learning AI. This is something that I'm starting to focus on. If you want to learn more about AI, I believe Ryan's going to be speaking on it here in a little bit. I'll be going over to see that. But AI, it has a lot of benefits from us. And, you know, directors, you can utilize this. Someone like me, I have horrible spelling and horrible grammar. You know, I'm very good at math and solving problems, but I'm not writing a book. So I utilize AI. I'll write the email on what I want to get out, and then it'll fix the grammar for you, so it looks professional going out to the leaders that you're emailing to. You can utilize it to develop slides like this. You know, all these images that you see on here, I generated through AI. I put in my talking points, the things that I wanted to talk about, and then said generate the image for this, and boom, done in 5 minutes, plop it right in here. So you can utilize this as a director, and then, you know, there's things coming too where, you know, it's already tied to remote access, you know, and there's a failure coming into remote access. They got AI now that can tell the technician exactly what to do once they get on site with that system. So there's a lot of cool things coming, and cybersecurity is big now too, because there's a lot of cyber attacks, hospitals being held hostage for ransom. So you really got to stay on top of cybersecurity. You know, we partner with Assembly to manage all our network equipment. So it's extremely important. And this is the direction the industry is heading in. And you really need to study this stuff and learn it. So why this all matters, you know, every downtime event isn't just a number, you know, it's a patient waiting. You know, every leader we build strengthens the future of HTM. You know, so everything that I learned from my coaching too, you know, I pass on to my directors here to develop them, and then I ask them to pass it on to their staff. So, you know, learn and then, you know, teach one. And then you got to lead for people, not just for performance. And then leadership is patient advocacy in disguise. The ROI of leadership, you know, better uptime, lower costs, stronger teams, safer patients. Leadership development is the greatest multiplier in HTM. you know, core leadership beats core metrics. You know, protect your time like your leadership depends on it. Use your influence like your organization's future depends on it, because it does. So that's a wrap on this presentation. This was just a quick overview of the things that I work on with my directors, you know, the things that I teach on. You know, each one of those 4 modules that I looked at, I do 6-week trainings on each one of those individually with my staff. So there's a lot more to dive in on this. You know, we're limited today to 1 hour in this room, and you know, I wanted to get this done so we could do some question and answers here. So that's all I have today. Any questions, answers for me? Feedback? I knew you were going to raise your hand.
All those changes, right?
Mm-hmm.
We work together. So
Correct.
I know the story.
Mm-hmm.
Right? I don't think anyone ever felt that they couldn't trust you because you were so busy. I think your style actually has been elevated to that.
Mm-hmm. Yes.
You know, in others, that's a problem.
Mm-hmm.
But out of all those things that you've altered, what's the biggest one that you think made a difference?
The blocking time and saying no to people. I was a people pleaser, so every time a customer called me, someone called me, I wanted to fix their problem, and learning to say no and telling them what my actual schedule was. It, you know, it doesn't hurt to say, hey, I'm working on this for these 2 hours. I will get to this at 2 o'clock this afternoon. That was the biggest change for me, and that's what was killing me, because you know, I'm very passionate about this job, about working in the HTM industry. So saying no to people bothers me. It still does. I still have to deal with this every day. I have trouble saying no. I want to fix everything. That's been my biggest thing, and making that change, and then having the weekly coaching still, where I go through how my week has went, and then she gives me advice on the things that I got to fix. That was definitely the biggest change. Yes.
Marcus, thanks for the introduction to joining, by the way. And I wondered, I've been doing the blocking of time as well, especially at least an hour in the morning, around the afternoon, so I can do what I need to do. Have you ever thought of or introduced having the people who contact you prioritize in their subject line 1, 2, or 3, maybe help you prioritize, like, you know, I'm trying to figure out what happens when a machine is down and it's in an OR. I mean, obviously somebody's going to be able to be reached to deal with that, but just that urgency versus, you know, what's actually needs to be done. Have you ever thought of
Yes.
trying to implement that?
So yes, putting that actual on the email, that's a great idea. I have not thought of that, but when I meet with them, I've done presentations to them in our weekly meeting on what is urgent, what deserves a phone call, what deserves a text message. And then also when I tell them with focus mode, there's certain customers that need to go through that. And a good thing with focus mode, you can put people's names in there to bypass through it. So you're cutting out all the noise. So like I said, this is a 1-hour presentation when I was hitting highlights, but there's a lot deeper stuff that I go into with them. And that is one thing that we do address. And I also talk to our customers. I'm very open and transparent with my customers about everything that I do. That's why I have very good relationships with all my customers. And I tell them I do this. And one of my customers in Las Vegas is actually implementing this stuff with their staff because they liked what we were doing.
That help them understand what it actually means to them, how it plays, and that's missed. So I really, really impressed with your, what you're doing.
Thank you. I appreciate that. Yes.
How do you get those texts to take that hour?
Talk to Tony and Randy. They have to deal with that for me. But it is very difficult. And when we first was introducing this, they felt like we were dumping more work on them. They're like, I can't believe you're adding this extra hour to my day. I'm like, you got to do it anyway. I'm like, it's a policy that this gets done. And we had to explain to them, and it's a lot of coaching that you have to do to show them how this actually works, and it saves them time over the long haul. You know, we had to enforce it, and then over time, I think they see that this actually benefits them once they started doing it. I mean, it's the same with me with blocking time too. When I first heard that I had to block my time from a coach, I was like, what are you, nuts? I go, how am I going to answer all these calls? How am I going to do all this? And it took me just doing it for a while to see that it actually benefited me and made me more efficient and more productive.